Hello, welcome to my channel. Subscribe or dale like if you like. Today we are going to talk about allopurinol medicine. We will explain its mechanism of action, its side effects, its dosage, its uses, its contraindications, its warnings, pregnancy and indications. The trade names of allopurinol are Zyloprim, Lopurin, Aloprim, Zyloric, DERTRIFORT, PURIBEL 300, ETINDRAX, UNIZURIC 300. Mechanism of action of allopurinol. Decreases the level of uric acid in plasma and urine by inhibiting xanthine oxidase, an enzyme that catalyzes the oxidation of hypoxanthine to xanthine and xanthine to uric acid. Therapeutic indications of allopurinol. Treatment of clinical manifestations of uric acid or urate deposition in idiopathic gout, uric acid lithiasis, acute urate nephropathy, neoplastic and myeloproliferative disease with high frequency of cell turnover, in which high levels of urate are produced, both spontaneously and after cytotoxic treatment. Enzymatic alterations with overproduction of urate, hypoxanthine guanine phosphoribosyltransferase, including Leschenien syndrome, glucose 6-phosphatase including glycogen storage disease, phosphoribosylpyrophosphate synthetase, phosphoribosylpyrophosphate aminotransferase, adenine phosphoribosyltransferase, glutathione reductase, glutamate dehydrogenase. Treatment of 2,8-dihydroxyadenine kidney stones, related to deficient activity of adenine phosphoribosyltransferase. Recurrent mixed calcium oxalate renal lithiasis, in the presence of hyperuricuria, when measures such as diet, fluid intake or other therapeutic measures fail. Allopurinol dosage. Oral dose. Adults, mild alterations, 100 to 200 mg per day. Moderate alterations, from 300 to 600 mg per day. Severe alterations, from 700 to 900 mg per day. In the elderly, use the lowest dose that produces a satisfactory reduction of urates. Children under 15 years old, from 100 to 400 mg a day. Malignant processes and Leschenien syndrome. Kidney failure, start with 100 mg per day maximum. In renal dialysis, 2 or 3 times a week, from 300 to 400 mg immediately after each session, and do not administer in the days without dialysis. Liver insufficiency, reduce dose. Side effects and adverse reactions of allopurinol. Skin rash, increased TSH, thyroid-stimulating hormone, very rare frequency, agranulocytosis, thrombocytopenia and aplastic anemia, especially in kidney or liver failure. Contraindications with allopurinol. Hypersensitivity to allopurinol. In case of treatment for an acute gout attack, prophylactic therapy may be started when the acute attack has completely subsided, provided that anti-inflammatory agents are also taken. Warnings and precautions with allopurinol. Liver failure, kidney failure, patients being treated for ETS or heart failure. Discontinue in case of hypersensitivity, skin rash. Once they have remitted, if necessary, restart treatment at a lower dose, 50 mg per day, increasing gradually. In case of recurrence, suspend administration definitively due to the risk of more serious hypersensitivity reactions. Treatment should not be started until the acute gout attack has passed. In initial stages it can precipitate an acute attack of gouty arthritis, administering as prophylaxis an anti-inflammatory or colchicine. Hydrate properly. Risk of hypersensitivity reactions of different forms including maculopapular exanthema, hypersensitivity syndrome, DRESS syndrome, and Stevens-Johnson syndrome, SSJ, or toxic epidermal necrolysis, TEN. If these reactions occur during treatment, the treatment should be withdrawn. Resumption of treatment should not be carried out in patients with hypersensitivity syndrome and SSJ/NET. If the patient is a carrier of the HLA-B 5801 allele, assess the risk or benefit and monitor for signs of hypersensitivity syndrome, Stevens-Johnson syndrome or toxic epidermal necrolysis. Liver failure and allopurinol. Caution and reduce dose. Perform periodic tests of liver function, during the initial phases of treatment. Renal failure and allopurinol. Caution. Start with 100 mg per day. In renal dialysis, 2 to 3 times per week, 300 to 400 mg immediately after each session, and do not administer on days when dialysis is not performed. Interactions of allopurinol. Increases action and toxicity of 6-mercaptopurine, azathioprine, adenoside arabinoside, cyclosporin. Increases effects of theophylline, warfarin and coumarin anticoagulants. Increases frequency of skin rash with ampicillin and amoxicillin. Effect diminished by probenecid and high doses of salicylates. Increases plasmic max and AUC values, didanosine. Pregnancy and allopurinol. There is no appropriate experience about the safety of allopurinol in pregnancy, although it has been widely used for years without apparent clinical consequences. Its use in pregnancy will be only when there is no safer alternative and when the disease itself carries risks for the mother or child. A study carried out on mice that received high doses intraperitoneally on days 10 or 13 of the pregnancy period showed the appearance of fetal alterations, but studies carried out on mice, rats and rabbits that were given high doses orally on days 8 to 16, showed the absence of side effects. Its use in pregnancy will be only when there is no other safer alternative and when the disease itself carries risks for the mother or the child. Breastfeeding and allopurinol. Its use is not recommended during the breastfeeding period. Allopurinol and its metabolites occur in human milk and may cause adverse reactions in infants. Therefore, its administration is not recommended during the nursing period. Effects on the ability to drive with allopurinol. Since adverse reactions such as drowsiness, dizziness and ataxia have been described in patients treated with allopurinol, they should not drive, use machinery or participate in hazardous activities until they are reasonably convinced that it does not adversely affect their behavior.